AIDS is caused by HIV and can be transmitted prenatally. If the virus passes through the placenta perinatally by exposure to blood during birth, and postnatally by breastfeeding. Bottle feeding reduces the rate of HIV transmission from affected mothers to their infants. If HIV infected pregnant women are not treated, approximately 15 to 35% of infants will be infected. Treatment of the mother with AZT reduces the risk of transmission to 5%. Adverse effects are associated with prenatal exposure to air pollution, cigarette smoke, lead, and/or mercury. Research on pregnant women and infants from the vicinity of the World Trade Centers, which collapsed following the 9/11 attacks. The fetuses of women who were closer to the World Trade Centers had greater exposure to pollution. The infants were born lighter, shorter, and slightly earlier than a control group of babies whose mothers were not living near the World Trade Centers. 3 years later, some of the children showed decreased cognitive abilities. It turns out that prenatal exposure to pollution in combination with cigarette smoke led to complications that were not present in children who were exposed to just one of these prenatal risk factors. Children exposed prenatally to lead are smaller at birth and may be born preterm. They also show impaired intellectual functioning as infants in proportion to the amount of lead in their umbilical cords. Postnatal lead is also dangerous. It is estimated that 1 in 4 children under age 6 in the United States lives in a home with lead dust from old paint or old lead water pipes. Exposure to even very low levels of lead, lower than previously thought to be safe, is associated with lowered mental function during childhood. Studies looking at prenatal exposure to mercury from maternal consumption of fish suggest adverse consequences including delayed development as well as memory, attention and language problems, with the effects correlated to the amount of mercury exposure.